COVID-19 cases are dropping across New York State. This is positive news. However, the Omicron variant continues to impact communities in New York City. We're taking a closer look at the Bronx right now, the borough with the highest rate of transmission. Okay, so according to the New York City Department of Health, 81% of adults in the Bronx are fully vaccinated compared to 84% of adults citywide. When it comes to children ages 5 to 17, the health department says 41% of children in the Bronx are fully vaccinated compared to 47% citywide. Joining me now is Dr. David Collymore, who is Chief Medical Officer of the Acacia Network. It's a nonprofit which provides medical care and housing programs for underserved communities. And Dr. Collymore, you have 6 community health centers in the Bronx alone.
Yes, we do. Yes, we do. 6 community health centers, large housing portfolio, a skilled nursing facility. So we have a large footprint in the Bronx itself.
All right. Thank you so much for being here. And I know the Bronx is where you were born, raised in Queens. So this means, as a pediatrician, I'm sure any geographic area would mean so much, but the Bronx is a special place in your heart.
Absolutely, absolutely. I always say I get to take care of myself. I get to take care of kids that were in the same position I was in.
Sure.
Not that long ago, just a few decades ago. So it really is an honor and a privilege to serve as the Chief Medical Officer of the Acacia Network.
What are you seeing with the Omicron variant in the Bronx?
We're seeing a very high rate of transmission. It's a highly contagious strain of COVID-19. Fortunately, within our practice and within our residential programs, we have not seen a significant amount of morbidity, and we have not seen mortality, which is fortunate, but it definitely is a very highly transmissible form of COVID-19.
You're doing everything you can. You held an open house vaccine clinic last weekend. How did it go? And are you seeing more acceptance rather than hesitancy among residents and your patients?
Right, well, we are seeing, we're vaccinating every day. So we're seeing individuals coming into our practices every day. We're doing it on a walk-in basis. And we did host a dedicated vaccine testing event this past Saturday. Our goal is really to provide access and education. And I think that's really what is necessary to combat disparities. And that access has to come from a trusted healthcare provider, such as the Acacia Network. We have the ear of the community. We've been embedded in the community for decades. Much of our staff is either born or lives within the communities that we serve. So our communities trust us, and we have to leverage that trust to get more acceptance.
How do you leverage that trust? Because we saw the numbers as far as children being vaccinated. How do you tell parents, convince them? Obviously, you don't want to run over them. This is an ongoing conversation, but how do you get them to get their children vaccinated?
Yeah, I think, well, the trust starts with the relationship. So the relationship that we've had with families for years is the beginning of that conversation. So it precedes the pandemic itself. And then you have to meet folks where they are. You have to hear individuals' concerns, answer questions, and then also present the facts. And the fact of the matter is that the Bronx has been devastated throughout this pandemic. Highest rates of mortality, highest rates of transmission, even as we speak, the highest rate of transmission in the city. So we have to speak about the reality of what we've been through, the reality of where we are, and that's what we use to educate and inform our patients and our staff also. And once you have informed and educated patients and staff, that's when you get the acceptance.
When you speak, you spoke about disparities in communities, and let's just go deeper in that as we've gone through each stage of, the horrible getting of COVID, and then we've moved through Delta, Omicron, the vaccines, the booster, and now this at-home testing plan. Talk about accessibility for your patients, residents in the Bronx area, and other people Acacia serves. Just getting it, and then will it help?
Now with the at-home testing kits,
yes.
It really does empower the individual to be able to test themselves and to be able to isolate when there is a positive test result. So I applaud the federal government and the local governments for their efforts in getting it out to communities. But we also must be aware that every community does not have the same level of equity and access.
Sure, email, for instance. I mean, being able to go online, right?
Absolutely, absolutely. It's a challenge for many of the communities that we serve, and we will do all that we can do to help individuals through that process. So we've had campaigns even pre-pandemic where we've assisted individuals in acquiring email addresses and setting up Gmail accounts. And we will continue to do so in an effort to allow folks to have access to the at-home testing kits. And then there are folks that may or may not have a safe address to mail a test kit to. So there will definitely need to be provisions, and we're speaking with our local Department of Health and also communicating with the federal community health center networks to do all that we can do to distribute at-home test kits to the communities that we serve.
Dr. David Collymore, Chief Medical Director of the Acacia Network, thank you so much for being here and giving us information which I know will help viewers in the Bronx, but beyond that too as well, Dr. Collymore. Thank you.
Thank you. Thank you for the opportunity, and we thank you for your support.
You're welcome. If you'd like more information about where to get a vaccine or booster shot, go to our website, cbsnewyork.com.